Welcome to Clarity Education Systems, also known as PMHNP This is an asynchronous recording of our live 2-hour information session that we do for those preparing for the certification exam through the ANCC. Had various requests to make this available online at other times because they weren't able to actually go to the live session. So although this is recorded, please send us your text messages, your emails, however you'd like to reach out to us if you have questions about the information that you're going to receive today. We're pretty quick about responding. It obviously won't be in real time like it would be during the live session, but you should hear from us pretty fast. But we wanted to make this available to anyone who would like to see it and not able to join one of the live sessions. So with that, we'll go ahead and get started. So I wanted to just introduce myself. I am the lead instructor here at Clarity Education Systems. My name is Dr. John Rossi. I am a certified psychiatric mental health nurse practitioner, as well as a certified medical surgical nurse. That's my clinical background. I'm currently working as an executive officer and get to see the full spectrum of healthcare through administrative and the clinical side. I did receive my Bachelor's of Science degree at Brigham Young University, and within that degree, I majored in nursing and minored in gerontology. My Doctor of Nursing Practice was obtained at the University of Missouri, where I studied psychiatric mental health care through the lifespan and also minored in nursing education. So my passion for all of this started in my capstone. I did complete a capstone at a detox facility in Utah. It was a wonderful experience and kind of opened my eyes to what mental health care could be and how it ties into so much of physical care as well. I started my career as a nurse, as a medical surgical Air Force nurse, went through all levels from floor to charge nurse to nurse manager, and then running the in-house operations for both ICU, medical surgical, mom baby, ER, psychiatric mental health placement. So really all areas of healthcare. Finished that job and then went on to be a family practice clinical manager at a family health clinic, and currently working as a psychiatric mental health nurse practitioner and executive officer. So that's a little bit about me, where I come from. I just wanted to give my ethos so that way you know I'm not just here as a mouthpiece. I actually have a background in this information, and I'm very passionate about not only nursing, about being a provider, but more specifically about how mental health is so vitally needed in our world today, and you are needed. And we are excited to have you soon join our ranks as a mental health provider. All right, now this picture in this little video resonated very strongly with me. It's how I felt when I was preparing for my certification exam. Completely overwhelmed, information all around me, piling on top, and I did not know what to do with it. I didn't really feel like school prepared me for the exam. Although information was given, I don't think I necessarily was ready to take a certification exam like I did when I was preparing for the NCLEX, for example, or my medical surgical certification. So completely overwhelmed, and I needed some direction, and I didn't know where to go. So I, like many of you, started looking at certification prep materials. I actually did 4 different ones. They all had things that I liked. They all had things that I really disliked. And primarily it was understanding the material via the instructor, or just the materials that were given in the notebooks, or the simple fact that it was just too broad or it wasn't narrow enough. And that's what led me to the point where I'm at now. I wanted to create a program that was specifically designed for working individuals that needed a very focused and identified way of studying for this exam, so that way you felt prepared when you went in on test day, but did not feel completely overwhelmed by the process. So with that, we designed PMHNPtesting.com. And as I said, it's a division of Clarity Education Systems, which in and of itself is a part of Clarity Mental Health and Wellness. And that's where we came up with our program. And this is how I prepared for the test. This is how I passed the test. And this information is updated daily and is ready for you to help you get ready for this exam. All right, so we'll go ahead and jump into the first part of the preparation material. I just wanted to introduce you to the ANCC certification exam itself. Who is the ANCC? What are their statistics? Why do we use it? So first and foremost, there's a lot of good news when it comes to the test. when I was in school a number of years ago, there was this rumor going around that it was the hardest test you could take. It was worse than the nurse anesthesia test, and less than 50% of the people passed it. I'm here to tell you that's all false. All right. It is a very doable exam, and it's something that you can accomplish on the first time. So this information on the screen is directly from ANCC and is the statistics from 2021. It's the most recent statistics that we have. So for the PMHNP test, 6,100 people tested. Of those 6,100, 5,300 passed the exam. Now, look at that in percentages. 87% of people that took this test passed it. Those are good odds, okay? Feel confident in the fact that when you go take this thing, you're probably going to be with the vast majority of test takers in successfully accomplishing this exam. I wanted to compare that with family nurse practitioners. That's one that a lot of people go after. And so you would think that's more available for test taking materials and more people are going to pass that one. But if you look at the numbers, I think you'll be pleasantly surprised. 7,300 took it last year. Of that, 6,300 passed, which is approximately 87%. So we are right on line with the family nurse practitioner students as far as the passing rate whenever you're going in and taking this exam. So be confident. The numbers are there. The percentages are good. You're going to pass this test. So ANCC identifies some key documents that you need going into preparing for sitting for this examination. You do need to have all of your transcripts. This includes both official and unofficial. So these are documents that you're going to want to start collecting now as you are entering the last semester of your school within the 6 months, first 6 months of taking your test. A validation of education form. This one can be a little tricky to get. You just want to make sure that you present that to your school officials. Typically, I say go to the academic advisor and they'll let you know who this should be sent to. But it's just what it is. It's a validation of your education that lets the board governing body know that you have taken the required education to go in and sit for this exam. Now, there is a gap analysis form. All that is for somebody who's already a postgraduate of, like a nurse educator that already got a bunch of the higher education points, already has a master's degree, and now is going to go on for either their post-grad or their postdoc. So it's going to connect those two education points, what you've already done with what you're currently doing now for your mental health degree, and that's that gap form. That is essential if you're going back to school and you already have a degree. Then finally, you're going to have to send in your official transcript. Before they will give you a test date, before they give you your permission codes, you have to have an official form that says you are certified and you have received that actual degree. It has to state that it has been awarded. Until you have all of these documents, you will not be able to test. These are some of the forms that typically back you up, okay? I know you probably go online and see all the horror stories about it's taken me 9 months to get in for this test. A lot of times it's because the right forms have not been submitted. So you want to make sure that you've got all of these documents ready to go. So kind of put that at the top of your list. Check, check, check. Now I can go in, start studying. Now I can go ahead and schedule my test once these forms are submitted. All right. So the ANC certification exam, it's not unlike your other certification tests that you've already taken. It is a little different than your nursing NCLEX exam, though. This is not one of those tests that is, based upon where you are on that line, right? If you're above it for so much, it'll shut off at a certain point. It's not like that. You're going to get 175 questions on the exam. Of the 175, 150 are scored for an actual grade. There are 25 pre-test questions that the board puts in there so that they can have future questions. So it's basically they're judging how students do on them and if they're good or if they're well written. So these questions are not graded. They will be thrown out. They are not part of your actual score, but you will have to take them and you will not know the difference between the 150 scored questions and the 25 just kind of out there questions that are for future tests. The exam is worth a total of 500 points, all right? So you will need a minimum of 350 points of the 150 testable and gradable questions in order to pass the exam. So what does that break down to? What does that equate to? You need a 70 to pass, all right? So that is 105 correct questions out of the 150 questions that are graded. So that's your target. You don't care if you make a 90 or above on this thing. Only thing you are worried about is getting 105 out of the 150 to give you a 70%, and that will give you your green check at the end of the test. It is nice to have those 25 additional ones in there, because a lot of times you'll go through the exam and you're like, I am missing a lot of these questions. In my mind, all I said was, you know what? That was one of the 25 that's not gradable, and I can throw that one out. And that will help give you some confidence as you go through the test. You really do. You've got a lot that you can miss. And then on top of that, you have 25 that aren't graded anyway. So we're just focusing on the 105 out of 150 to get you through to that green check at the end of the test. So now for the ANC certification, it is broken up into certain domains. And each one of these domains helps you to identify what needs to be covered through your studies. And we will help you. Everything that we've designed is specifically written for each one of these domains, so that way it's covered in your preparation. So scientific foundation, this is both a knowledge and skills-based area. So this covers things like advanced pathophysiology, advanced pharmacology, neurodevelopment, neuroanatomy, advanced physical assessment. We also have advanced practice skills. So once we get a good foundation of these scientific topics, we need to move on to the practice skills. Things like clinical interviewing, health promotion, disease prevention, mental health screening tools, your PHQ-9, your GAD-7, psychoeducation for the patient, recovery and resiliency promotion, risk assessment, all very key areas that are definitely testable on the exam. We also have diagnosis and treatment. Again, this is a knowledge and skills-based area. So this is when you're going to get introduced to more of your DSM-5 diagnostic criteria, how to identify which one of these diseases is actually being talked about in the question. Diagnostic impressions, differential diagnoses, evidence-based practices, management of medication. So all key diagnosis and treatment topics. Psychotherapy and related theories, again, a knowledge and skills-based level. Psychotherapy principles, cognitive behavioral therapy, grief and loss, change theory, developmental theories, family theories, therapeutic alliance and development. So all of your real, heavy-based theories are covered on the exam as well. Okay, finally, we have the ethical and legal principles. Again, knowledge and skills-based. So these are things like your patient's bill of rights, the scope of confidentiality, to include a release of information, duty to warn by the provider. We have your ANA scope of practices and standards, cultural and spiritual competencies, and patient advocacy. So all key areas. It's a lot of information. And if you're like me, that was your current mood, you're feeling completely overwhelmed. Don't stress about it though. There's so much you can do to prepare for this test and not feel like it's all coming crashing down and just crushing you. You can do this. And that's the main point I want you to take away from this session today. This is a doable test. You have spent years preparing for this. It's going to happen. You're going to accomplish. You need patience. You need a little bit of humility to understand that you don't know everything and you have some work to do. And then finally, you have to preserve and persevere up until the very end and just have that faith that you need in order to get the test done. So you have to be confident, first and foremost. You have and will be graduating from your program soon. So you know the information. You know things. You need to focus and regroup, but you know this information. You need to begin your review, and we want to be there to help you do that. Don't get overwhelmed by all the information. If you're in the middle of your master's final or you're in the middle of your DNP project, it may not be the time for you to be worrying about this. Get all that done first, then focus on the exam. You want to have focused study using the ANC test content outline. We've done that for you. All of this is built based on their outline. Last one was updated in 2019. So we've done that part for you. And then finally, you want to gather all the resources and you want to take as many practice tests as you can. Again, we've done this part for you as well. So you have to create a study plan. What works best for you? We have used ANCC's recommendation of doing a 6-month out test prep option. That's why we recommend at about 6 months before taking the exam, you watch this information video and you start to figure out what you need moving forward to prepare for the test. 6 weeks of daily prep is what we are saying is good to go. That's going to help you prepare enough for the test. There is a 2-week crash course if you're one of those individuals that does not want to spend every day, or maybe you can't because of school, work, and family. But you work really well under pressure, right? So there's a 2-week option to just kind of cram it all in there and then just go take the thing and get it over with. You want to adapt based on your personal preferences, and we can help you do that as well. So write out the plan, get down, get your notebook out, type it up on the computer, write what you think is going to work best for you. Learn how to take breaks, stay motivated, join our Facebook group, join the Instagram groups, join Twitter, whatever you need to stay focused and motivated moving forward, so that way you have a solid plan in place. Again, we do most of that for you. That's the joy of taking a review course. ANCC highly recommends that you take a review course. Why not this one? It's way more affordable than the other ones that are out there. And again, that's just the information that you need to know. This is a blip in time, this exam. You don't need to reinvent the wheel. Just study what needs to be studied, take the thing, and then move on with your life. So we can also facilitate private team virtual study rooms and study sessions for those of you that are wanting some extra study time with other individuals and other classmates. Whatever it takes, we're going to set it up for you. That's part of the program. We do utilize Teams. I have found that through the pandemic, Microsoft Teams is really kind of went far beyond other programs like Zoom as far as setting up an interactive online environment for education. So we, even though you may not be in a study session or a class that week, or I'm sorry, you may not be in a class, but you can join a study session. We'll create rooms for you to go in and log in with friends that you've made, or join together as a school to take this program, and then you can study with each other online. All right, get your study on. Again, that's the most important thing, is just get started. Like I said, ANCC recommends that you take a review course. Here it is, hyper-focused, engaging, and based on the ANCC guidelines. You want to use a wide variety of study materials to include flashcards, things like videos, podcasts, just written material that you've done yourself, worksheets, all things that we'll provide for you. You will not need to know everything. You will never know everything. Focus on content missed and learning how to answer what is being put in front of you. Even though you may not know what the answers are, there are techniques to get through questions to help you get the right answer without even knowing the answer itself. And then you want to learn to refine and refocus. Once you get to a point where you understand something, don't keep harping on the things that you know. Focus on the things that you don't know. That way you're getting a solid foundation of as much information as you can. All right, and then we want to focus on test-taking strategies. You want to watch for key points: age, gender, diagnosis, length of the illness, specific signs and symptoms. These are all key points to remember when answering a test question. We're going to highlight them. We're going to use the tools that the Prometric test gives you to highlight those and remember them as you're working through the question. You want to be aware of key terms and words like always, never, accept, first, best, priority, assess, or an intervention. Read the question. Try to answer it before reading the answer options, okay? And then when you've got what you think your answer is, then go through each one of the answers and see if you can find the one that you went with right away. Trust yourself. Answer it and then leave it alone. Assume nothing, okay? When you're taking these questions, everything that you need to know to answer that test question is in the actual stem of the question itself. Do not interject anything that you think, well, they may have said this, but they should have considered this also, so I'm going to go ahead and use that as part of my formulation for my answer. That's wrong. If you did not get it in the question, it does not exist for the answer. So do not invent anything that isn't there. It is okay to answer the ones you know first. Click come back later to review those. And then once you've gone through all the ones that you're confident with, going back and answer the ones that you don't know. Just make sure that you answer all of them before your time is up. Anything left unanswered is counted against you on this test. And we'll walk through day before and day of test taking strategies in the actual modules. There are some specific things that you're going to want to do in preparation for going into the actual test room. All right, and so now we're going to move on to the Prometric testing site itself. That's the website where you can go on and get some really good information. We've kind of covered all the high points here. It's offered both at home via live remote proctoring and also on the in on-site testing centers. This is what ANCC recommends. I also recommend you actually go to a Prometric testing site instead of doing it at home. There's just too many distractions, too many things that could go wrong. Be safe and go to the testing center if you can. Testing occurs in a large room with other students separated by cubicles at individual computers, just like when you went to take your NCLEX exam. You will be required to store all of your belongings, and you are allowed to wear a jacket, but that's it. Okay, it must either be worn at all times or placed on the back of your chair. You can't lay it in your lap, have it on the floor. It's on your body or it's on the back of your chair. The hospitality of Prometric administrators varies, as does the cleanliness of the sites. So I always recommend going to the actual testing site, go inside, see what it's like, talk to the person at the front desk, see if it's a clean environment, something that you're going to be comfortable with being in there for 3.5 hours. Get to know your testing site. There are some horror stories of people going online, clicking a testing site, thinking they're going to go there, and then when they show up and it accepts them and everything, gives them a testing date and time, and then they go to the testing site and it's been abandoned and it's been closed for a year. That person obviously isn't going to test that day. So you want to make sure that you call them. You want to go and check out the site before you schedule it to make sure you feel comfortable with where you're going. You will be searched and photographed prior to entering the testing area. At-home test takers will use their camera to verify themselves, and then you have to do a 360 up and down of your room. It has to be done in a room with enclosed walls and a door that can be closed off. It can't just be, in a general area where other people can walk in. So you do have to have a nice closed off space for you to take it at home. You will be given a dry erase marker and whiteboard. Boards vary based on the location. Sometimes they'll have lines. Sometimes it'll just be a blank whiteboard. But you'll use that as your scratch pad. Now, the Prometric site offers a digital scratch pad. It's a floating window on your computer, so you can type on it for home digital notes during the exam. All notes are destroyed, so they'll all be wiped off clean before you leave the Prometric testing site from your whiteboard, and then your digital board at home will also be turned off and cleaned off, so you won't be able to save anything. Now, you are allowed time at the beginning of the exam to read through the instructions. It's about 20 minutes. This time does not count towards your overall test taking time. Okay, so this is a good time to do your pre-test notes, or what we call the cheat sheet here in our program. We're going to go over the cheat sheet here in a little bit. So use it. You got 20 minutes of free time to kind of data dump everything, write it all down on your scratch boards before you go through. The information that you're getting through the instructions, it's really not necessary to read it. We're going to go over what happens when you sit down to start the test. You're just clicking, screens to get to the actual first question, and it's going to tell you what you can take breaks, but you're going to have to keep your time going. That's all you're going to get. Most important thing to do during that 20 minutes is to actually jot down your data dump. All right. You can mark questions throughout the exam. You can cross out answers by a click. It'll cross it out if you don't want to consider that answer anymore. You can also highlight words in the question text body. You want to do all three of those things. So if you need to move on and come back to that question later, you're going to click it, and it'll give you a list of ones that you haven't answered. As you're answering the questions, A is wrong. You're going to click it. It's going to scratch it out. So now you don't have to worry about it anymore. And then as you read the question, I want you to highlight specific words. And those are the only things you're going to focus on when you go to reread the question to go on to answer it. We're going to practice it later on. A timer will count down from 3.5 hours. Okay, that's the time that you have to take this test. You are allowed to use the restroom and take a break, but keep in mind you have to be at your desk or in the restroom and then right back to your desk. You don't get to go anywhere else during that time, and your clock will continue to count down. So don't waste too much time. You want to take breaks, go to the bathroom if you need to, but just be very mindful and cognizant of where your your counter is at, so that you don't end up wasting too much time and you don't have enough time to answer all your questions. All right, once your test is complete, it will ask you multiple times if you're ready to finish the exam. This is what stressed me out the most in the test. I would say, yes, I'm done. I'm ready to find out. And then it would ask me again, are you sure you want to be done with this test? Yes, I'm sure. Are you positive? So you're going to get really stressed at this point because you aren't seeing that green check. Don't worry about it. You know now it's going to ask you multiple times if you're done for real before you get to the last page. Your passing results will display immediately. You will get a message saying you have passed, but you don't get a final score. All right. This is not the green check page that you see everybody posting on social media. It's a very small green check with the very small line word underneath that says, congratulations, you passed your exam. So don't panic if you don't see the big page that everybody continues to post online. If it says you passed, you passed. If you do not pass, there will be instructions explaining when you should expect a section breakdown to help prepare for a next test that you're going to take in a couple of months. Don't panic if that happens. It's okay. This is a almost cheat sheet for you. You don't need to focus on the things that they didn't tell you you failed. You only need to go back and re-review the things that you may not have, weren't as strong with on this particular test. Not a big deal. It happens. And I know people that have gone their second, third, and even fourth time, they passed their test, and now they are all practicing nurse practitioners. Don't panic. But like I said at the beginning, 87% of the people pass this thing the first time. You're going to get that green check. Once you pass, you'll receive your gorgeous green check via email within about an hour. And that's going to be the page that you see everybody posting on social media. That's that big green check. And just like Oprah Winfrey says, everybody gets one. You're going to get a green check. I want you to get that in your mind. You're going to pass this test, especially if you prepare. And we are here to help you with that. That's just a quick breakdown of the ANCC exam itself, the governing body, and then what to expect in the Prometric testing sites moving forward as you go in to take the exam. Okay, so our first topic we want to go over are drug-to-drug interactions. So this is an introduction to the content that you're going to receive throughout our various seminars as you move through the preparation materials that we have to offer at PMHNPtesting.com. This was one that I struggled with whenever I was preparing for the test, so I wanted to introduce it to you. It's a hard one, right? Drugs are always difficult. There's so much that goes into understanding the drug-to-drug interactions and the various types of drugs, antipsychotics, antidepressants, and how they interact with the body and how they produce either positive or negative side effects. So as you go through our program, you're going to see this flashing key. You want to look for it because those are key concepts. Those are high yield data points that you must know for this exam because you're probably going to see it on one of the versions of the ANCC test. So keep an eye out for that flashing key. So two things that you really need to understand are pharmacokinetics and pharmacodynamics. They're easily understood, but you can also easily mix them up. So pharmacokinetics is how the body interacts with an administered medication, or quite simply what the body does to the drug. That's things like metabolism. Pharmacodynamics is how a drug at a very molecular, biochemical, and physiologic level affect the body. So this is what the drug does to the body. The easy way to remember this is that pharmacodynamics has that D spelled in the word. D for dynamics and D for drugs. Pharmacokinetics will be what the body does, but pharmacodynamics will be what the drug does to the body. And these two concepts are important to understand as you go through and understand exactly what drug-to-drug interactions are. So in medication interactions, there is a change in a medication's effect on the body when taken with a second medication. And that's what, by definition, is a drug-to-drug interaction. Now, this results in either a delay, a decrease, or an enhanced absorption of either one of the drugs. This can cause a decrease or increase in the action of either or both of the drugs, and that's what ultimately results in the adverse effect. So this can occur in the following ways. One, the two medications have very similar effects on the body and are too strong in combination. So this is a classic example of serotonin syndrome. Two medications or two SSRIs that are both taken to increase serum serotonin levels, which results in that serotonergic stimulation. Drug-to-drug interaction of two medications with similar effects. So one medication changes the metabolism of another, resulting in medication entering the body, diffusing throughout the bloodstream, and then finally exerting its intended effects on the target organ. And because we're in mental health, that's usually the brain, where most of the psychotropic medications affect. So an example of this is a patient is taking sertraline or Zoloft and begins taking a mood stabilizer, such as carbamazepine or Tegretol, which is a known inducer. So the inducer speeds up the metabolism of the other drug. So sertraline metabolism will increase, resulting in an overall decrease in drug effectiveness. So we're in a different situation here, right? Before, on the previous screen, we were talking about two similar medications creating too much of a situation. And in this, we've got two different medications, when taken together, are either decreased or increased based on the effect of one inducer or inhibitor. So Tegretol inhibits sertraline, speeding up the metabolism of the other, induces speeding up the metabolism of sertraline, resulting in a decrease of medication available. So then we have the opposite example of that. So to the same patient, they begin taking Norvir, which is an HIV retroviral. It's also a strong inhibitor of specific medications. This results in decreased metabolism of Zoloft and an overall increase in the amount of sertraline or Zoloft in the system. So now we got to worry about how much we're dosing and how often that patient is receiving the dose, because the metabolization of that med is decreased because of the inducer drug Norvir. So physical causes are also needing to be focused on as well. Liver disease specifically. Liver disease can impact enzyme activity and affect drug clearance by reducing drug metabolizing capacity, reducing the synthesis of plasma proteins, causing changes in liver blood flow and medication distribution. As it goes through the body, it's going to be affected at that checkpoint of the liver, and this results in toxic drug levels. And finally, varies based on the chemical characteristics of the medication and the severity of the actual liver disease itself. So liver disease can definitely be a factor in how drugs are absorbed or how they're passed through the system, and it can either result in too much or too little based on a health history of liver disease. Kidney disease as well. Although the majority of psychotropic medications are in fact metabolized by the liver, the kidney can also be a factor. We have reduction in kidney clearance caused by medications, and it can increase drug serum concentrations. And with this one specifically, I want you to think about lithium. So lithium, when taken with another drug, may end up being increased in the system. So NSAIDs, thiazides, and ACE inhibitors reduce kidney clearance, resulting in increased lithium drug serum concentrations. And then we start getting into lithium toxicity. We cover lithium toxicity in depth because you're going to see one of those questions on your test, if not 3 or 4 or 5. All right, old age is also another factor when it comes to interactions with drugs. So old age can greatly affect the way medications interact with the body. A lot of decrease here. So if you're answering a test question about old age affecting the body, probably going to look for the answer that's opposite of the decreased, right? So decreased intracellular water causes decreased protein binding capability. Now this one's, it's not necessarily due to old age, but some of the disease processes that we go through as we age. We have decreased or lower muscle mass, and then finally our bodies decrease in metabolism. So drugs are not metabolized as well, and they can stay in the system for a longer amount of time. So old age, definitely a consideration. Now, this is a key screen here. Inducers decrease, all right? So if we have an inducing drug, we want to remember the D in inducers. Inducers decrease serum drug levels, and that results in subtherapeutic amounts. So if you're taking an inducer, inducers decrease subtherapeutic. So we have decreased drug levels because of increased metabolism. So inducers increase the metabolism and decrease drug levels, subtherapeutic. At the opposite end of that, we have the inhibitors. So inhibitors, look at the spelling of the word inhibitor. There's high in there, not H-I-G-H, but close enough. So high. Inhibitors are high. They increase serum drug levels, and then that drug becomes supratherapeutic. So inhibitors increase drug levels because of decreased metabolism, resulting in supratherapeutic or too much drug in the system. So one of the key components to understand drug interactions is comprehending enzymatic processes. Now we're going to go back to the P450 enzyme that you probably learned about in school, but if you're like me, you forgot about it instantly. This is the cytochrome P450 enzyme. Enzymes decoded or encoded by the P450 gene, expressed as membrane-bound proteins in the endoplasmic reticulum of the liver. Again, liver, key point, key factor in drug interactions. So there are multiple P450 enzymes involved with hepatic metabolism. These are some of your most common ones. We'll go over them more clearly in the actual seminars. But the your 1-alpha-2, okay, you can get rid of the CYP to make it simpler, but your 1-alpha-2, gotta know those. 3-alpha-4, definitely. 2 delta-6s. So what does this mean? An example is Zoloft, sertraline. So Zoloft is metabolized by the 3-alpha-4 enzyme. As we know, Zoloft is an SSRI. Fluoxetine or Prozac is also an SSRI, but it is not metabolized by the 3-alpha-4. It's metabolized by the 2 delta-6. So if you're taking a drug that is either a known inducer or a known inhibitor of the 3-alpha-4, then you might want to take a drug that is not metabolized by that enzyme. Okay, so can you kind of see how it's all starting to come together here? Inducers or inhibitors, specific drugs or work on specific enzymes, and different one, like you have 2 SSRIs, but metabolized 2 different ways. So you want to start thinking about how you're going to medicate your patient if they're on a medication that's either going to inhibit or induce the psychotropic that they're taking. Simple point of it is understand the basics of inhibitors and inducers and how they affect enzymatic activity with the P450, cytochrome P450. We're going to go over that in depth in the seminars as well. Okay. All right. I do want you to focus on the main inducers. These are the ones that are more than likely to show up. I like to have the mnemonic Bull Shark, Crap, GPS Plus. There's a dirtier version of this. I try to keep it clean on the videos, but if it works better for you, I think you can probably figure it out. But I use Bull Shark, Crap, GPS Plus. These are your barbiturates, your St. John's worts, that's your BS, carbamazepine, rifampin, alcohol, phenytoin, so that's your crap, your grizofluvin, phenobarbital, sulfonylureas make up your GPS, and then that extra that we're going to add on there is smoking and the pill. So these are all known inducers. And what do we remember about inducers? It has a D in the word. Inducers decrease drug levels, right? Because of increased metabolism. All right, if we got to know the inducers, we got to focus on those inhibitors as well. So inhibitors can cause big frickin' problems. BFP, bupropion, fluoxetine, and paroxetine. So these are all drugs that inhibit high. So we have increased drug serum levels because of decreased metabolism. Super important concepts to understand. Big freaking problems are your inhibitors. All right, and that's kind of the down and dirty of the drug-to-drug interactions. Just an example of what you'll receive during the seminars. Next, we're going to move on to antipsychotics, another hard and popular one on the test, also known as neuroleptics and major tranquilizers. So antipsychotics are used in the treatment of the following disease processes, and they are primarily dopamine antagonists. So we have schizophrenia, that's going to be your number one, always testable. Psychotic episodes during depression and dementia, those can occur. Bipolar disorder, delusional disorder, and then in certain circumstances, you'll also use antipsychotics for anxiety and agitation when your other options have failed. So antipsychotic medications have 5 primary side effect profiles. These are the things you're going to be looking for in patients that you start on an antipsychotic: anticholinergic, sedation, EPS, weight gain, and other metabolic effects. 5 side effect profiles. Now, although many of the patients being treated with antipsychotics can be cared for in an outpatient basis, hospitalization may be required, and a patient's status has to be monitored closely. As a matter of fact, most of your patients are going to be started on these antipsychotics in an inpatient facility, and then you're going to be caring for them when they go to the outpatient side if you're an outpatient provider. So prior to selecting antipsychotic medication, a complete medication reconciliation, past medical history, past psychiatric history, and physical assessment to include patient's motor state are all required. Why? We kind of talked about it in those drug-to-drug interactions, for example. You need to know what medications they're taking. They may be on something that is an inhibitor or an inducer, especially if they're a smoker, right? Bull Shark Crap GPS Plus. That plus is included in those inducing drugs. So you got to really get a good health history, medication history when dealing with these patients. So both the efficacy and the known side effects of antipsychotics are attributed to blockage or antagonism of dopamine receptors. However, dopamine receptors are not the only ones involved, all right? You can also remember the rest of them with the mnemonic block MASH. So block as in block dopamine, MASH. Muscarinic acetylcholine receptors. These are where you're going to start to see all of those acetylcholine related side effects: constipation, urinary retention, blurry vision, dry mouth, things like that. Your alpha-1 norepinephrine receptors. So alpha-1 receptors are found throughout the entire body, especially in the vasculature system. This is where you get orthostatic hypotension and reflex tachycardia. Serotonin receptors. Modulation of these receptors may be the reason for an improvement in treating depression and other bipolar type diseases. However, they will cause sedation and weight gain because of that receptor modulation. And then finally, histamine receptors to close off the MASH. This results in sedation, weight gain, insulin resistance, diabetes, hyperlipidemia, a lot of those weight gain issues, and other metabolic issues. So dopamine blockage, this is so key. You have to know this part. Just memorize it. So you've got 4 different pathways that we want to focus on when it comes to antipsychotics and dopamine. So the mesolimbic area or the mesolimbic pathway results in a decrease in hallucinations when we block it. So if we take an antipsychotic, we block dopamine from the mesolimbic area, we have decreased positive symptoms, decreased hallucinations, delusions, and other schizophrenia and psychotic type symptoms. Now, if you block dopamine in one area, you're going to be blocking it in all the areas. So you have to know what happens in the other pathways as well. So the mesocortical pathway, when dopamine is blocked, causes diminished energy, lack of motivation, restrictions on emotions, and alterations in social engagement. So negative symptoms. So although the positive symptoms may be improving, you may start to see some negative results in the mesocortical pathway. Then we have the nigrostriatal pathway, and this leads to your EPS-like symptoms, such as tardive dyskinesia, Parkinson-like symptoms, tremors, muscle rigidity, difficulty starting and stopping movement. Nigrostriatal, that's going to be all of your movement complications when we block dopamine. And then finally, we have the tuberoinfundibular pathway. When we block dopamine there, we decrease follicle-stimulating hormone, or FSH, which increases prolactin in the body. That causes amenorrhea, so no periods in women, gynecomastia, and sexual dysfunction. Those are extreme side effects, and they're primary reasons why your patients your male patients in particular, stop taking their antipsychotic medications. Nobody wants breast development. Nobody wants milk production as a man, at least a good majority of them. And then sexual dysfunction, that's hard for both males and females. So tuberoinfundibular, blockage of dopamine in that area can cause those side effects. Again, we got to block it. If we have a schizophrenic patient and they need medication, mesolimbic, we're going to target those primary symptoms, But because we're targeting one, we're also going to be targeting them all. And that's where you start to see a lot of your side effects when it comes to antipsychotic medications and treatment options. Okay, so in order to overview here, whenever we take an antipsychotic, we reduce the number of hallucinations, delusions, and thought disorganization. We decrease the ability to focus, reduction in attention and concentration. We increase movement abnormalities, such as EPS. We can cause an enlargement of breast and milk production or release. And then finally, sedation, apathetic appearance. So all things to remember when prescribing antipsychotics. Now, we have different generations of meds in order to consider for an antipsychotic treatment. First generation, or your typicals, they block almost all dopamine from dopamine receptors 1 through 5 in the brain. That, as you've learned here, right, if we block all the dopamine, we're going to have those issues with primary, secondary, and then movement disorders and issues with follicle stimulating hormone. So common first generation antipsychotic drugs to know, I want you to focus on these 3 on the screen, specifically Haldol, haloperidol. We'll go into these more in depth in the actual seminars. Second generation are atypicals. Now, what's so special about these is the fact that they block both D2 receptors and 5-HT2 alpha receptors. So we're not blocking everything, but, well, I want to clarify that. We are still blocking everything, but we're primarily blocking D2, all right? So your dopamine. However, if we're blocking one, we're blocking them all. This is just more focused on the D2. But we also block 5-HT2 alpha. So we have moderate D2 blockage with 5-HT2. So the blockage of 5-HT2 alpha, we think that the reason why this helps with second generations with some of those symptoms is the fact that we may increase levels of dopamine in areas of the brain that are in need of dopamine and are deprived of it when using a typical or a first generation antipsychotic. Okay, so second generation, modest D2 blockage, so modest dopamine blockage, but that's bumped up with 5-HT2 alpha, which helps replenish dopamine in areas of the brain that typically cause some of those extreme side effects faced by antipsychotic use. Sometimes you have to go with a first generation. You've tried second generation, they weren't as effective, so we move on to a first generation. We have signs and symptoms, we have things that we're going to have to deal with, and we're going to have to help the patient get through them, but ultimately it may be needed. But there is a big difference between the two. Your primary test question you're probably going to see when identifying the difference is going to be that modest D2 blockage with 5-HT2 alpha. All right, so common second generation antipsychotics to know, Clozaril, Zyprexa, Seroquel, Risperidol, Guiadon, Abilify, and Latuda. Don't get too hung up on both the generic and the technical name for these drugs. They're both going to be on the test. So if you have one that's easier for you to remember than the other, just make sure you remember it. If Abilify is easier to remember than Ariprazole, you're going to be fine because they're both going to be on the test. Now, of these medications, I want you to also focus on the Ziprasidone, Ariprazole, and Lorazepam. ZAL, Z-A-L. These drugs are going to be implicated with fewer instances of weight gain among the antipsychotic drugs. So if we have somebody that's worried about weight gain, this is a way that we can try to combat that. ZAL, Z-A-L, she's a skinny gal, ZAL. Ziprasidone, Ariprazole, Lorazepam. These are second generation antipsychotics with fewer instances of weight gain compared to other antipsychotic treatments. So we don't have time to go over everything in this recording today. There's a lot to cover, obviously, but I wanted to give you a taste of what you can find and how we break down each specific drug class in order to get through the advanced pharmacology seminars. So additionally, in these seminars, we're going to focus on a variety of key issues to memorize and to understand as it pertains to not only antipsychotic use itself, but primarily education for the patient, because education is going to be a big part of it. It's in those domains that we talked about earlier in the session. All right, before we move on, we have to talk about NMS if we're discussing antipsychotics. You will see this on the test. So NMS, or neuroleptic malignant syndrome, is caused by adverse reactions to antipsychotic use. There's a couple of examples there of some of the primary ones. Haldol, definitely. So these are more common with first-generation antipsychotics, and they present with characteristic patterns. And I want you to memorize these by using the fever mnemonic here. So fever, F-E-V-E-R. What can we expect from a patient with NMS? Fever. So we can expect F, fever, E, encephalopathy, V, vital sign instability, E, elevated white blood cell and CPKs, and R, rigidity. All right. So on a test question, they're probably going to say, a 45-year-old white male comes in, you've assessed him, and you're going to go ahead and start him on an antipsychotic because he has schizophrenia. A week later, he shows up in your clinic with fever, elevated white blood cell count on lab results, and muscle rigidity. You can ask, what's the problem? And you're going to say he's got NMS, or it can ask, what is your nursing priority at this time? It's going to be to stop that medication and treat it. We're going to talk about what medications are used in the treatment of NMS. There's 2 specifically, but that's NMS. And NMS in a nutshell, you have to know this for the test, especially the difference between NMS and like serotonin syndrome. All right, so these are the flashcards for the antipsychotics that you're going to see. In the program, we're going to give you all kinds of flashcards, all kinds of medications that can be utilized throughout the test, and you'll want to memorize them. And so we'll have them written out perfectly like this, already typed out. And there's also blank versions that you can go in. There's going to be stuff that's deleted so that you can go in and write it in yourself. I like to do both. I like to see it written out, but then I also like to go in and write it out myself. I'm going to be using different areas of my brain, right brain versus left brain. It's going to help with memorization, both long-term and short-term memory. You got to know all that too. Hopefully you pay attention to that. You got to understand where short-term and long-term memory are formulated. Those are found in the seminars as well. But flashcards are definitely a good help tool for that. So be expecting those as well. All right, so now that's the end of the actual content that I wanted to introduce you to. Lots of others that are included in the seminars. Hours upon hours worth, but it is very focused, and hopefully will be fun as we go through the classes. An important concept to understand is the cheat sheet. If you have not received a copy of the cheat sheet, it's something that I give for free. You can use it on your test, even if you don't use us for preparation. Please shoot me an email, let me know, and I can get you a copy of it. But the cheat sheet is what it is. It's a cheat sheet. It's what I want you to use when you sit at the test for the first 20 minutes and data dump all of this information. These are the things that I found most helpful to jot down, because it's easy to get frustrated and confused on the test question when you're dealing with scales and like Erickson's and Piaget's. So I am hoping that you'll be able to memorize this, write it down in 20 minutes or less. And then when you get a test question, quickly jump over to your cheat sheet, find the answer, boom, you've got it. Less than 20 seconds, you're moving on to the next question, and you can feel confident about answering those and know that, hey, at least I got that point right. So what you see here, it's all filled in. So your scales, you've got the mini mental status exam, the SLUM, HAM-D, PHQ-9, Beck, HAM-A, GADS, the GAD-7, COWS, SIWA, Erickson's, Haupt-Focal. So I'm going to teach you how to utilize all these and memorize them. But primarily on the test for Erickson's, you're going to see an age. So if they're 12 years old, now 12 is kind of a tricky one because you got industry or identify. You got to kind of think about how old is this kid in the test question. If he's 6 to 12, I'm going to go with that one. If it's things that should be happening for a 12 to 20-year-old, I'm going to go with identify. But primarily, it's going to be like a 3-year-old. What's the problem? Autonomy. Like, you'll be able to go real quickly using your cheat sheet. BMI is important. You do need to know BMI. I don't think they're going to ask you to calculate BMI, but they are going to want you to know what's considered normal, abnormal, obese, and then how to intervene. For example, a patient, if you have a 14-year-old female that comes in and they are a BMI of 13, that's a medical emergency, and that patient must be admitted to the inpatient facility for treatment. They could die from it. And then if you have a parent that's absolutely refusing, you're going to notify Child Protective Services, because that is considered endangerment of the child. they need and have to be admitted. And you are required and are responsible for that because you've taken on the care of that kid, and their BMI is so low, they have the potential to die if they aren't worked on right away. So there's a blank version of the cheat sheet that I give you, so you can kind of go back and forth, memorize it, and then write it down yourself a number of times till you get to the point where you've got it committed to memory, muscle memory. You jot it down on your test date, and you move on to that question as quickly as possible. So that's your cheat sheet. Those are your flashcards, easy, simple tools to utilize in test preparation, and it will help prepare you. And I feel confident in saying you're going to pass with it. If you will do them and be religious about how much you go over them over the 6-week process. So what I want to do now is just move on to some practice questions. And anytime I talk to students, this is when they freeze up and they get all panicky. Don't panic. This is what you're here for. You're here to take practice questions, and then you're here to take questions on the exam. So don't freak out. You can do this. It's easy, and we're going to teach you how. Definitely don't panic. There are strategies that we talked about at the beginning of the seminar. You want to narrow it down to 2 possible right answers. Get to that 50% range, right? Most of the time, you can do that, even if you don't know what the answer is. Culture is important. If you're asking, if the question is specifically identifying this is a Native American or this is an African American, if this is a Caucasian, those are key words and may need to be included in the question, or it may need to be included in the answer. So culture is important. If it's a cultural related question, your answer has to include something to do with that culture of that person. Quality of care and conflict management are important nursing goals. So if it's asking that in the question, you need to address it in the answer. You want to look at the root action. Is it an assessment question? You want to match the answer to the actual root action. If it's an intervention question, find an intervention, not an assessment. You want to be careful of alls or nothings and everythings. They're usually wrong. Critical thinking is vital. If it's a critical thinking answer, it's probably right. If asked to refer or consult to someone else, it's most likely not the correct answer. You are the referring person now. Your nurses are going to refer to you, right? So unless it's like out of your wheelhouse, okay, something, a nurse practitioner, a psychiatric mental health provider should not be treating somebody for cardiovascular disease. That would be a referral out. But if the question is asking about, a mental health disease, you're the expert. So you need to answer that question. You don't refer it. Safety for the patient and others is usually, if not always, the right answer. If it's a safety related question, look for that safety answer. If see initially in the stem of the question, then you want to go back to ADPI. So initially, most often is an assessment type question. Not always, you can go beyond that. It just depends on what the question says, but you want to look at ADPI for any initial questions. Evidence-based is massive. What I did on the test is if it was like an information question and one of the answers had based on evidence-based blah, I chose that answer and I moved on and didn't even think twice about it and I passed. So I think it's a good indicator. If there's an evidence-based question based on an information type question, or what's the best treatment option for this patient, and there weren't really any options, but they talked about evidence-based, that's the one you want to go with. And then use those Prometric tools like I talked about at the beginning. Click on the, check it on the side if you need to come back to it. Use your clicking tool to mark out the answers that you already know are wrong, and then highlight words in the question that you focus on, and then don't have to worry about any of the other mess that's in the question itself. Those are just add-on words. You want to identify the key principles in the question, highlight them, and then move on to answering it. So great strategies to help you get through it. So we're going to move on to the first question, question number 1. In the live session, I would be asking people to take a stab at this, but I'll do it for you here. I want to give you a couple seconds after I get done reading it for you to practice it asynchronously, and then I'll move on to the answer. So question number 1 is it is important for the psychiatric mental health nurse practitioner to understand the body's response to mental health conditions. Which system is involved in acute fear and/or anxiety? Okay, first thing you want to do is highlight the important stuff and delete the rest, right? So the only thing I care about in here is which system is involved in acute fear and or anxiety. Everything above it is just junk. Which system? You may not know the answer to this one. You may panic, right? Is it the RAS? Is it parasympathetic, sympathetic, or mesolimbic? I'm going to say I don't know the answer to this, but what I'm going to do is I'm going to group. Two of these questions have similarities, parasympathetic and sympathetic. So I'm going to look at those. The renin-angiotensin system, I remember that from my medical background, so I'm probably going to delete that one. I'm going to put a one line because I think that has something to do more with medical. Mesolimbic, I know we talked about mesolimbic earlier today, having to do with schizophrenia. That's not really fear or anxiety, so I think I'm going to delete that one as well. Plus, parasympathetic and sympathetic have the same word in it. A lot of times they're going to give you a right answer and then an answer that's really close to the right answer and that you have to choose between. And this would be one of those cases. So I would scratch out A and D, which leaves me B and C, parasympathetic and sympathetic. I remember back to my nursing days, right? I know that the sympathetic is a fight or flight. Parasympathetic is rest and repose. Am I resting? Am I reposing, if you will, if I have fear and anxiety? No. I'm excited. I'm anxious. I'm ready to go. That speaks to me as sympathetic. So my guess here, best guess if I didn't know, after getting rid of 50% of the questions and then narrowing it down to my previous knowledge that I had in nursing, the sympathetic nervous system is associated with acute fear and or anxiety. So take a second, see if you agree with me. Correct. C, the sympathetic nervous system. So both anxiety and fear activate the sympathetic nervous system, placing the body into fight or flight. And this mode is in response to the release of epinephrine and norepinephrine. So there you go. Even if you don't know the answer, you can talk through the question to get to the right answer just by processes of elimination and referring back to knowledge that you previously had even before you started taking your nurse practitioner courses. Okay, moving on to question number 2. A 25-year-old male patient presents to the mental health clinic with complaints of gynecomastia following initiation of antipsychotic medication after an acute psychotic episode and inpatient treatment. The nurse practitioner understands that it is likely caused by the medication's effect on which area of the brain. Knowledge-based question, and you may or may not know the answer to this one right away, but the first thing we're going to do is we're going to highlight our important info. 25-year-old male, gynecomastia, following initiation of psychotic treatment. All right, so which area of the brain, when given an antipsychotic, can result in gynecomastia? That's all you need to know out of that question. So we're going to try and get rid of 50% of the answers, right? Tuberoinfundibular, mesolimbic, mesocortical, or nigrostriatal. If I don't know the answer, I'm at least going to go back to the things that I learned in the seminar. I know that the mesolimbic and the mesocortical are associated with either positive or negative psychotic symptoms, right? Off the bat, I know we're not talking about those things. We're talking about gynecomastia. So I'm going to go ahead and click using my Prometric tool, mesolimbic, B, and C, mesocortical, and X those out because they're associated with positive and negative symptoms. That leaves me with A and D, tuberoinfundibular and nigrostriatal. If I go back to my knowledge that I learned, if I have to guess between the two, nigrostriatal, I know that had to do with Parkinson's. Parkinson's is movement. That's not breast development and milk production. Tuberoinfundibular had something to do with FSH and prolactin. That could lead to gynecomastia. So based on that information, my best guess moving forward from the 50% is going to be A, the tuberoinfundibular pathway. And that is, in fact, the correct answer. So again, as we block dopamine in this pathway, it's going to increase prolactin, and that's what's associated with breast tissue development. And we talked through the rest of the answers, why those would not be correct. Very testable information. You got to know those areas and those pathways. All right, moving on to question number 3. So during an interdisciplinary staff meeting, colleagues are discussing a bipolar patient and how lithium might affect the heart. The psychiatric nurse practitioner responds, okay, so this is a knowledge-based question for an interdisciplinary team. Only thing I need to know in this test question is how lithium affects the heart. That's it. Nothing else matters. So let's see if we can figure it out just based on the rules that we've used. So lithium can shorten QT intervals. There is no effect. Lithium can elongate PR intervals, and lithium can result in inverted T waves as seen on an ECG. I may not know the answer to this because this is a harder question. But if you look at these four question answers, based on some of the stuff we learned before we started practicing, which one can we definitely eliminate? Okay, hopefully you said B, bravo. It's one of those absolutes, right? There is no effect. Really? I'm giving them a drug like an antipsychotic, and I'm sorry, like a mood stabilizer like lithium, and I'm expecting no effect. Don't believe that. So I'm going to use my Prometric tool, and I'm going to click B, and I'm going to line through it. Not the right answer. So that leaves me with three other answers that I may or may not know the answer to. Okay, I don't know if it shortens QTs, if it elongates PRs, or if it inverts T waves. So now I'm going to go on to another test-taking strategy. More information that is correct information, all right? So D tells me inverted T waves as seen on an ECG. Would I see, if there was a problem, inverted T waves on an ECG? I would, right? That is correct. An ECG would in fact show me T wave inversion. So that question, if I have to guess between three answers and I've got nothing else to go off of, I'm going to go with the answer that gives me additional information that is also correct. Now, I could have had two questions here that gave me additional information, but I want to make sure that the additional info makes sense for the rest of the answer response. And in this case, it does. So T waves do show on ECGs as inverted or not. So lithium can cause T wave inversion, and initial and routine echocardiograms need to be conducted while the patient is on lithium. All right, doing great. Question number 4. When treating patients in the Asian population, all right, we've already got a stopping point here. Asian population, which means we're dealing with a cultural-based question. There's probably something you learned in the seminars that specifically talks about Asian populations with mood stabilizers. It is important to remember which medication is associated with potentially life-threatening complications. So using my Prometric tool, I'm going to highlight Asian population, medication, potentially life-threatening complication. That's all I need to know out of that question. A, B, C, and D, Tylenol, Depakote, Tegretol, and Lamictal. One of these I can eliminate immediately. Which one do you think it is? Okay, hopefully you said Tylenol. I don't typically hear about Tylenol causing life-threatening complications, especially in the Asian population. So I can probably feel confident in one-lining that one. That leaves me with Depakote, Tegretol, and Lamictal. All three medications could potentially cause life-threatening complications in an individual. I might not know, though, which one is the Asian population complication. So I have to go with my best guess here, okay? I don't have any other way of narrowing it down. It's just based on information that you received in your study materials. Take a second. I want you to guess between Depakote, if you don't know, Depakote, Tegretol, and Lamictal. Which one of these has a life-threatening complication possibility in the Asian population? Okay, C, Tegretol, absolutely. If you take the course, you're going to hear this one a lot. This is a known fact, a known issue within this population. So Stevens-Johnson syndrome, rashes on the face, in some patients within this population can occur due to the presence of the HLA Bravo 1502 allele, all right? That genetic component results in Stevens-Johnson syndrome in some people because of the initiation of carbamazepine or Tegretol. Knowledge-based question, very, very testable. Okay, question number 5. Which of the following medications would the psychiatric and mental health nurse practitioner consider for a depressed patient that continues to report unresolved fatigue and low energy despite SSRI antidepressant intervention. What do I need to know? Depressed patient, unresolved fatigue, low energy, despite SSRIs. Now, what it didn't tell me is it did not say anything about whether or not the SSRI is helping or hurting the depression. So we don't care. That's not necessary information for this question. Only thing that we know is this patient continues to have unresolved fatigue and low energy, which may or may not be associated with depression. But as a nurse practitioner, you are charged with knowing augmentative therapies in order to help this patient. So there is a medication in this list of answers that will help with that. Now, what we learned earlier is that SSRIs, you need to be careful with those, because if you take an augmentative treatment that's also another SSRI or a medication class that will increase serotonin, then we might run into a drug-to-drug interaction. Now, in clinical practice in real world, as an NP, would I potentially prescribe 2 SSRIs? I could, absolutely, based on the patient's presenting symptoms and complications. However, in the test-taking ANCC world, that is a wrong answer. We do not mix 2 like medications because of the potential complications. All right, so just get that in your head right now. In practice, you may. For a test, you will not. So knowing that, which one of these answers can we automatically get rid of? Take a second to think about that. Okay, so I know that Bravo B, sertraline, Zoloft is an SSRI. I'm not going to use it. Okay, and I also know that fluoxetine or Prozac is an SSRI. So I'm not going to choose it. So that leaves me with duloxetine and bupropion. What kind of medication is Cymbalta? It's an SNRI. I'm also dealing with some serotonin in that situation. What about bupropion? Wellbutrin. So take a moment, guess which one of those is going to be your best option if you don't know it off the top of your head. C, bupropion or Wellbutrin. So Wellbutrin is a medication with a unique mechanism. It is a norepinephrine and dopamine reuptake inhibitor. No SSRI, no serotonin issue here. Could still come into play, but for this particular question, we're talking about norepinephrine and dopamine reuptake inhibition. So Zoloft, and as we said, Prozac are all SSRIs, and Cymbalta an SNRI. So the best option for this question to relieve that patient's symptoms is going to be Wellbutrin, bupropion. All right, moving on to our last practice question for our seminar today. In what stage of development does a 12-year-old child need to learn academic and organization skills to become proficient in play and schoolwork to develop a sense of pride and competency? Okay, this is a cheat sheet question, right? So all we want to focus in on is 12 years old, learning academic organization skills, develop a sense of pride and competency. So now let's jump back real quick. I want to get us to our cheat sheet. So on our cheat sheet, we go down to Erickson's. We have 6 to 12 and 12 to 20. 12 years old. I did that intentionally. I want this one to be a little more difficult. So it's either industry or identify. We talked about school play, right? At what age would we consider more appropriate for school play? 6 to 12 or 12 to 20? 6 to 12, right? Those are the school ages that we are most focusing in on with the questions that are presented in this test question, right? So a 12-year-old with these skill levels needed, we're going to use B, Bravo. So look at those again, industry versus inferiority. So we would have been looking at industry or identity. But because we know the age is appropriate for the question itself, industry versus inferiority is most appropriate. And that question will take 10 seconds or less to answer, and you can move on and save a lot of time. So industry versus inferiority encompasses school-age children from 6 to 12. They work on their ability to learn, interact with peers in that elementary level to organize and to understand. So friends and classmates play an important part of development during this stage. The goal is to become proficient at play, schoolwork, and to develop pride. Individuals unsuccessful in this stage of development, according to Erickson, possess a sense of inferiority regarding understanding and organization. All right, and so that's how you'll use the cheat sheet. Very simple to use, and it is an extremely effective tool when trying to get through the test. All right, that kind of concludes the content portion and test question portion of this presentation. Hopefully it was helpful for you, not only to just have some more information to study if you're preparing for your exam already, but to show you what we have to offer. It's very, very concise, very comprehensive, but it's also focused. The things that you learned today, I would definitely know. It's very, very likely that you'll see maybe even a very, very similar question to the ones that we practiced on your test whenever you take it, but definitely going to be within that ballpark. So I know there's a lot of question about pricing. I wanted to go over that quickly so that you know what you're getting as you move forward. So this program is designed at a 6-week completion. However, seminars are available for separate purchase as well if you need to just focus in on one thing. Let's say you did fail the test previously and you only need to focus on ethics. You can buy just that ethics package. It includes planning guides, handouts, and other materials to assist in organization and focus throughout the process. So each seminar includes practice questions embedded throughout, just kind of like we did today. And then you'll also get justification. There are 2 175-question practice tests that's included with the packages only, so the 6 and the 2-week package. They are not at this time available for individual purchase, but I believe starting next year, we are going to offer that option if you just want some more practice test questions. We also have a question bank that will be starting with an app for both Android and iPhone. I don't think that's going to be ready till sometime next spring. All right, and so those test questions are going to be essential for you preparing for the actual exam and practicing time management, stress reduction, and building confidence. So those are included in the packages right now. All right, this is a little snapshot of what we have to offer. As you will see, it is very affordable. One of the programs that I did in preparation was over $1,200, which was ridiculous. Do not pay that much for a prep course. It's not necessary. You will find that most of the information they give you is not even needed to know for this exam. Is it good stuff to know for your practice? Absolutely. And if you want to purchase their book for practice, great. But for this test, it's not needed. You don't need to spend that much money. So we do offer the 6-week bundle, which is all of the seminars, including the just-in-time training, which is that 2-week bundle for $350. And that will also include the 2 175-question practice tests. You also receive a free bonus shirt. So I love merchandise. I love, kind of swag. So I sell t-shirts just for fun as part of the program. But purchasing this, so you can buy shirts on your own if you want, but purchasing this will get you a free shirt as our way of saying thank you and congratulations. You'll be able to just go on the website and pick out one that you want, and we'll send it to you. All we ask is that you fill out a quick summary and evaluation of the course. Once you finish taking your test, send it to us. Once we get that, we'll send you off your free shirt. The just-in-time 2-week course is a condensed 2-week version of the test. It's very quick. It's a 6-hour course with some worksheets and flashcard work for $245. And then we have each of the individual seminars: Scientific Foundations for $65, Advanced Practice Skills for $65, Diagnosis Treatments, Psychotherapy Theories for $100, and Ethical and Legal Principles for $65. So depending on what you need, I think that we've got a package for you. All right, this is an example of the weekly schedule for week 1 through 6, and then also for the just-in-time 2-week training. I believe it's vitally important that you have rest days. For me, Sunday is my rest day, so that's what I built into the system, but it can be reworked however you need in order to get your day off in there, but you have to take breaks. And this will take you right up until the testing point. If you need to go beyond 6 weeks, fine, you've got the info. If you need 10 weeks to study, just chart it out, make a diagram, utilizing the information that you got in the seminars and to spread it out. But whatever you need, we recommend 6. You can make it longer if you need to. All right, some of the additional costs that aren't included in this program are the ANCC Practice IQ. I highly recommend that you buy their question bank. It's going to get you hundreds of questions to practice, and we're going to be looking at certain topics that are covered in that ANCC package that they offer. Don't have to do it, but I highly recommend it. Okay, Review and Resource Manual, PMHNP 4th edition. Let me grab that over here. I'm going to leave the screen real quick. So that is what's kindly referred to as the Purple Book. We'll definitely be utilizing this. So I would purchase that. You can also find online versions, PDF format for pretty cheap. So definitely get that one if you want to do the course. All right, so 3 things that I recommend. These are for study and for your clinical practice. This is the Memorable series, Memorable Psychopharmacology, Memorable Psychology, and Memorable Neurology. I had the opportunity to get in touch with Dr. Jonathan Helt, who is the author of these books. He has some fantastic YouTube tutorials that go with these texts. He has given PMHNPtesting.com permission to utilize those videos and also these textbooks in our test prep material. So those videos will be embedded throughout the program. We highly recommend them, and I highly, highly recommend these books. You'll want them far beyond your test preparation time. All right, finally, Clinical Psychopharmacology, made ridiculously simple, which I don't have my copy here, but it's a small little white book, great for learning medications. And then Psych Notes by Darlene Peterson. I use this all the time in practice. Great for study prep material, great for clinical practice. So I wanted to include things that I think you'll actually use when you're done preparing for your exam. All of these tools are extremely helpful and will be utilized throughout the seminars. All right. This is an outdated certification certificate to get some money off of the certification. I know that they just did one for the holidays. So if you go onto ANCC's website, and I post this every time a new one comes out, I will post it on the Facebook and Twitter page. And then announce it if we're in a live session. But you can get 25%. It's significant. It's like $120 or something, $25 off your certification exam. So make sure that you're looking out for those same savings. This was summer savings, but they have now one for the holidays as well. But I will keep you posted on those as they come out. You'll just use that to purchase your certification. All right. Again, we have free shirts. If you utilize that 6-week program, they're super fun. I love them. I wear them, and we'll send that to you as a thank you and a congratulations. All right. We are through November basically now too, and those did fill up. We're going into December and then off into the 2023 schedule. I think we've got it marched out or sent out towards till March now. So these are all of the live dates. You can go on and find out what's available. This is posted on the PMHNPtesting.com website under schedule. Now, one thing I will add is I do believe we are going to start doing asynchronous video recording like we did for this video. You won't have the live interaction, but I understand that for some people it's not possible. So we are taking that into account, and we are producing those videos now. So there will be asynchronous versions available starting next year. All right, you've sat through all of this. I know you wanted a discount code. I want to give it to you, so we'll go ahead and move on to that. So whenever you purchase anything on the website, use Go Clarity as your discount code, and that will get you 15% off. You can use that on any product, the bundles, the separate packages of just one seminar, t-shirts, whatever you want to use it on, but that will get you 15% off as a thank you for sitting in our information session. And will hopefully help you save a little money. So there's a lot more that we present in our seminars. There's just too much to even introduce you to in these information sessions. It's a lot of knowledge, a lot of information. I totally get it, but we try to break it down and we try to organize it in such a way that you don't have to feel totally overwhelmed. The last thing I want to say, and I know you don't have any questions for me right now because it's recorded, but if you do, send me a message and I'll definitely get back to you, or one of our teammates will. This exam is everything that you make of it, okay? If you will take the time and be patient and be humble to the fact that you don't know it all and you never will, you will pass this thing, because we're going to give you the tools that you need to. And if it doesn't happen on the first time, we'll help you get through the second time. We will get this figured out. You will be a certified mental health nurse practitioner. Just have patience with yourself and be willing to ask questions, be willing to go the extra mile. and adapt if you need to do things differently if it's not working for you. All things that I would love to talk with you about. I try to be as transparent as I possibly can. Unlike some of these other programs out there, when you call or text or write us, you're going to get me 99% of the time. I'm never too busy to help a student out. Not only do I practice in real life, but I'm also an instructor. I teach at a university. So what you see is what you get as far as instructing goes. And I just want to make sure that you have everything you need to successfully pass this test and become the valued mental health provider that we so desperately need in this profession at this time. I am so adamant about moving our profession forward. We are mental health providers. We are nurse practitioners. A lot of us are doctors. Most of us are at least masters prepared. So we are wise, smart individuals that are fantastic teammates, and we just need you out there. So please do all that you can to get out there and fight the good fight as we help others overcome some of their mental health challenges and deal with it and live with them instead of be hindered by them. Thank you so much for sitting with us here today. Again, I'm John Rossi, Dr. John Rossi. This has been Clarity Education Systems, a division of PMHNP Have a wonderful afternoon if it's in the afternoon. Have a wonderful morning if it's your morning. And please reach out and let us know if you have any further questions or concerns, and share this information with your classmates. I want to help as many people as I possibly can. It was a pleasure being with you today. Have a great one. Bye-bye.